This is Rebecca Anderson. I'm very, very happy to be here on this sunny, beautiful day. Getting a little bit hot, but it sure started off as a beautiful morning here in Richmond. I am pleased to be here to talk with you both about the Baldrige Framework, which is put out by the National Baldrige Program, as well as hone in and talk about our state Baldrige-based program that Kevin mentioned at Virginia SPQA. Two of my favorite things. One is talking about Baldrige and how to apply it and use it within your organizations, and getting a chance to network and talk with ASQ people. As Kevin mentioned, I'm the Executive Director for Virginia SPQA. That stands for Senate Productivity and Quality Award. It is the Commonwealth's Baldrige-based program for helping business organizations here locally improve their performance, their strategy, and their operations. I'm also a private consultant. I work in the greater Richmond area helping service-oriented government, healthcare, nonprofit organizations to perform better through more efficient, effective, compliant, customer-based processes. And the Baldrige Framework really provides the foundation, if you will, for the work that I do in my consulting business. I have a passion for helping individuals and organizations apply Baldrige regardless of the size of the organization or even the organization's readiness to apply a sophisticated program like Baldrige. I like meeting organizations where they're at, starting there, and seeing what fits. I have extensive experience using training and evaluating organizations based on the Baldrige Criteria, both as a state-based examiner here in Virginia as well as in Illinois, and I've also worked with the Veterans Administration program that utilizes Baldrige as well. At the end of my talk today, you're going to see my contact information, so be ready with paper and pen if you have questions or want more information about the SPQA or Baldrige, feel free to contact me anytime. As we move through this discussion today, you will see where you can type questions into the chat box. Please feel free to do so, and those will come directly to me. I plan to pause about midway through today and answer some of the questions that have come in, and then of course we can pause at the end to answer additional questions. So feel free to use that chat to type in your questions as they come. All right, so let's get started. As I mentioned, I'm going to start today. Just a moment, my slides are not advancing as they're supposed to. There it did. All right. Sorry about that. So I'm going to start by talking about the National Baldrige Excellence Program. I believe that context is important to start with in understanding a concept, a tool or approach, and how it's best applied or used. So I'm going to begin with an overview of the national program and what it's all about. So in 1987, the Malcolm Baldrige National Quality Improvement Act was passed by Congress. It set out to establish a program within the National Institute of Standards and Technology to address improvement of U.S. business quality and performance. It was named for the late U.S. Senator Malcolm Baldrige. At the time, considerable concern. Remember, this was the 1980s, and there was considerable concern that our businesses, particularly our manufacturing businesses, businesses leveraging technology to create products, that we were losing ground, particularly against the Asian market, namely Japan. I know I'm talking to a quality professionals, and I know you're very aware of what was going on in Japan in the 60s, 70s, 80s, and why that they were beating us in the competition. For myself, I came of age in the 1980s, and I remember my first car was Japanese made, And as I prepared for this talk, it dawned on me that every car I've owned since has been Japanese made. And I think that says something about the branding that was happening in the 80s, certainly in my own brain. And I associated excellence in car manufacturing with Japan. So that's what was concerning our senators, our folks in government in the 1980s. So we have that concern, and we have NIST, again, the National Institute of Science and Technology, establishing this Baldrige program. Under that act that I just described, the Congress specifically said, we want you to establish a program that will identify and recognize the organizations in the U.S. that are implementing state-of-the-art business management and quality practices. So a way of identifying and recognizing them. They wanted to see this program establish criteria for the evaluation of these businesses and their practices. They wanted the program to establish those best practices and then a way to share widely and freely among U.S. businesses how to get better. I think largely what the Baldrige program does for organizations is it creates a network of support, a community of organizations committed to excellence. Originally in the 1980s, the Baldrige program targeted manufacturing businesses. However, later, healthcare, education, the nonprofit, and more service business areas of focus were added and emphasized. And today, all are equally well represented among applicants for the award program. And there are essentially three sets of focus, as I mentioned: business, nonprofit, which includes manufacturing, government, as well as service-oriented business, and then education and healthcare as three distinct areas. The criteria itself to assess the excellence of businesses regardless of sector are virtually identical. So in other words, if you looked at the business criteria, it would look almost identical to the education, which would look almost identical to the healthcare. The difference across them is mainly in terms of some verbiage and vocabulary. For example, the healthcare set of criteria talks about patients more than it talks about customers. And education, of course, talks about students and parents as an example. So the framework. When I talk about Baldrige and when I have my elevator speech and I'm needing to give a quick synopsis of what Baldrige is, what it does, I use the phrase that it is an integrated management system. Okay? Let's think about that for a minute. And that it's a framework. I like that word framework as well. For me, what Baldrige does to an organization, it emphasizes the systems perspective. It helps an organization to pull together, to integrate its various processes, its leadership structure into a whole. How often do we talk about our organizations as siloed, where the right doesn't know what the left is doing? In worst cases, one department may not even know exactly what another department does or how they get it done. At its most basic level, Baldrige offers a blueprint or a guide for bringing the systems, the departments, the leaders, the people of an organization, bringing them together so that they're speaking the same language and they're moving in the same direction and so forth. We talk about it a framework, we talk about it being holistic. It's adaptable. As I said in my introduction, one of the things that I'm passionate about is adapting Baldrige to organizations even if they are much smaller in size, nonprofits. In other words, organizations that we don't traditionally think about using the whole Baldrige framework, but there are definitely ways to adapt it to different audiences. It is very cost effective. Many of the guides, the self-assessment tools, the case studies that you'll find, for example, on the Baldrige website, are free of charge. And then the state-based programs like the Virginia SPQA, we exist to provide low-cost services of training and evaluation services. We keep the cost low because we are entirely volunteer-based. It also aligns strategy, operations, and results in I think, a unique way. So the Baldrige framework not only talks about or assesses, provides a checklist, if you will, for aspects that an organization should have in place to get its best performance. It also asks the organizations to track their data and report on their results and link those results with their processes, so that you know that if you establish a best practice process, is it working or how can it be improved upon in your own organization? About a year or two ago, we started talking about the Baldrige Program framework, and we're slowly but surely changing our vocabulary from the Baldrige Criteria to the Baldrige Framework, because we want to emphasize that the Baldrige Program is more than its criteria. It has core values, the set of criteria obviously, and some key concepts, like its concept of customer, its concept of what a process is. These are all part of the Baldrige Program that are important to understand if you're going to implement Baldrige. Here's a look at the Baldrige core values, and you'll recognize them. They are very commonly used by organizations all over the world, really. Baldrige emphasizes the two bottom or foundational values, which are the visionary leadership and the systems perspective. These two things are foundational. They must exist in an organization for an organization to truly be excellent. And then the others are support values as well. Now we're going to begin talking about the criteria so that you can get a sense of what the Baldrige Program criteria address. Here you have the 6 considered the key integrated aligned processes that lead to improved results for an organization. The National Baldrige Program is led by what's called a Board of Overseers. And one of the tasks of this group is to continually review, research the top performing organizations around the world for what works, how are these organizations succeeding in the way that they are. And then they compile these best practices and make note of these as key processes. Leadership. For example, we know that the highest performing organizations have leaders that are value-driven and that create a culture, leaders that are visionary, and strategy, that organizations that are at their peak performance have a process for strategic planning and then deploying that strategy through the organization. So the key processes are grouped into essentially these 6 buckets, and they become the criteria. Let me give you perhaps a better example so you can imagine how the criteria look. We talk about the categories of the different criteria. 3.2, customer engagement. So organizations that perform very highly have a means of engaging their customers, building relationships with their customers. Okay? They have a way of involving these customers in the creation and the improvement of their products or services. They have a way of allowing their customers to seek support and help. And they segment their customers into groups and market segments, and they treat the market segments a bit differently. So, and you can see the repetition of the word how. So when we talk about the criteria, when we're assessing an organization based on the criteria, we're asking, what is your process for determining what your key products are going to be or how they are going to be improved? How do you hear from your customers? How do you enable them to seek information or support about your product? So the how is another way of saying, what is your process? So we're looking for repeatable, documentable processes. So that's how the criteria is structured. When an examiner is evaluating an organization based on the criteria, they are looking at these 4 dimensions, if you will. So as I mentioned, we're looking at key processes. So for example, what is your key process for providing support and help to your customers in relation to your product? Is there an approach? Do you have a consistent and reliable way of getting that information? So for example, you might have a call center, or you might have a website that allows for some two-way conversation to answer questions about your product. All right, so that would be your approach. Then we ask, and we delve a little deeper and ask, how well is your approach applied? Deployment starts to get at, you have an approach, but are you consistently using that approach in all the areas where it's warranted? So if you were a multinational organization, you had customers from all over the world, are your customers from all over the world able to access that support line in a similar fashion, regardless of where they're calling from? That would be one way we might look at deployment. All right, the individuals that are running that customer call center, are they all trained in a consistent way so they provide a reliable service? Again, that's getting at deployment. And then we have learning, which again is an even more sophisticated sort of an approach to your processes. So you have your process, you have it widely deployed across your employees, across your customer segments. Are you learning? Are you improving that process as you evaluate its effectiveness? As you learn about new innovations in how customers want to access your support. So that gets at learning. And then finally, the integration. What we're looking for here is, again, remember that silos problem that we have. Are different departments at least applying process in a way that don't conflict with one another? Also, is your approach integrated with your overall strategic plan and strategy? So if, for example, in your strategic plan for your organization, you have emphasized that customers are important, that you want a two-way mechanism to learn from your customers and support your customers, then we're going to start looking for, well, do your processes support that it's two-way? Do your processes support this emphasis that you've put on it? All too often we'll see organizations that might, for example, emphasize in their strategy that we are customer-centered. We want to hear from our customers. They're the most important thing to us. And then we might ask them, okay, do you have a way of collecting satisfaction information from your customer? Well, no, we don't. We really don't have a consistent way of doing that. That shows a lack of integration, as well as problems in approach, deployment, learning, I suppose, but that they're not focusing their energy and improving processes on things that they have said are important. That is really important in the Baldrige program. I was just talking about the process criteria. And just to go back real quick, remember we look at processes across 6 different dimensions: leadership, strategy, customers, which I just gave you more explanation on, measurement, analysis, knowledge management. That's clustered into one group. How are you measuring your processes? How do you transfer knowledge to new employees, for example? Your workforce, how are you recruiting and retaining people? How do you support your workforce? And then your operations. How do you make sure that the things you're producing are done safely and with high quality and to meet customer expectations? So moving back then, I want to tie that to another section of our criteria which we call results. So it's a separate section, if you will. Organizations that participate in the Baldrige program are required to produce data, to show their results as they relate to these processes I just mentioned. Okay? Customer-focused results. Example, that might be our customer satisfaction. It might be our market share, for example. Well, market share would probably fall under financial market results, rather. But you see the point. Leadership and governance, workforce, product and process results. Again, whatever that organization has said is important to them, is key to their strategy and their effectiveness, we want to see results. So if that organization has said customers are the center of what we do and they're most important to us, then we would expect to see data that is related to customers and how the customers view their product and so forth. An example of the criteria from the results section, the customer-focused results. So in my example earlier, I talked about how do you support your customers? How do you allow for them to seek help and information about the product? Well, here we see, here's the data we want to see about how are you doing at that? So what are your, look at number 2 there, what are your customer engagement results? We might be asking about measures, data related to that customer support process. So there has to be a link. So an organization is evaluated through the Baldrige program or can evaluate itself by using the Baldrige criteria in looking at, okay, do our results relate to what we've said is important? Do our processes relate to what we've said is important? Do they all fit together? So you start to see why the Baldrige program is talked about as an integrated system. Those results criteria items that I was just talking about, they are also, much like the process items, the results items are assessed or evaluated on these dimensions. So to the extent that the organization can produce, can show that they have numerical information, data, using a meaningful scale that evaluates the performance of their processes. That would be like check. They have levels. We want to see the levels. That would be the most basic requirement for understanding their results. Trends. We also want to see, is there trends, and are the trends showing a favorable direction? We want to see trends that are showing improvement over time. And the span of time can be whatever the organization has determined is important, whether it's daily, quarterly, monthly, yearly. Okay? And in Baldrige, we define a trend as 3 points of data moving in the same direction. Okay? And again, we're looking at favorable trends here when we're evaluating a organization. Comparisons. As you know, data is most relevant if it's tracked over time and if it's compared to an appropriate competitor or other kind of comparison. Here we're looking at data available, internal, external, comparative, competitive data. All right. Different organizations have different ability to get data on competitors. I know in healthcare, which is where my background is, there's a plethora of data out there that we can use as comparison. I know there are other sectors where it is more difficult to get their hands on particularly competitor data. But it's important to make that attempt and find some comparisons. And then finally, we're back to integration. And this is the same concept I talked about before, indicating that sort of the highest level of an organization's maturity in terms of its performance in excellence and quality is there this harmonization across plans, processes, information that is consistent. What we look for here as an example is we're back to, are they measuring the things that they have said are important to them? So the organization that says safety, a healthcare organization says safety of our patients is one of our primary concerns. We're going to want to see results that reflect safety for that organization. So we're looking for that consistent story. So I'm going to pause now and I'm going to look at my questions. And I think we've had a few. Let me see. I think I saw. Oh, right. I lied. We have one. We have a question that is, what are the key differences and similarities between Baldrige and ISO 9001? This is a great question because I get this a lot, so I know it's something that folks are interested in. I think they're interested in it because there is a realization that both bring tremendous value to an organization. Both can represent quite an investment for an organization. So I get asked, are they interchangeable, are they complementary, or are they very different, and is there conflict at all? I think to start with, I want to go back to Baldrige, this concept of framework. Another thing we do when we talk about Baldrige, we talk about it being non-prescriptive. If you look through the Baldrige criteria carefully, you will find nothing prescriptive. For example, you will not find a section that dictates exactly how a patient safety process should work. For example, there's nowhere in the Baldrige that prescribes that root cause analysis must be used following a patient safety incident in a hospital, or a failure modes and effects analysis must be used following an incident. If you look under the strategy section in Baldrige, you will not see anything prescribing that a Hoshin plan, strategic planning cycle must be used. What is prescribed is that the organization have a process of planning strategically. That process could be, having a brainstorming session and recording your ideas on a napkin. If that works, and you can show that it works for your organization, good. So Baldrige attempts to kind of meet the organization where they're at from their lens and is very non-prescriptive in terms of particulars. I think ISO is more prescriptive. Not that ISO is completely prescriptive either. I think if you look on them on a continuum, you would find ISO being a bit more prescriptive in terms of how documentation, how risk management should be shown, although I would not say it's an extreme in terms of prescriptive either. I think that Baldrige, and probably most importantly, think of Baldrige as a way to address quality and performance organization-wide. So whether you're talking about human resources, IT, leadership, safety and quality control within an organization, finance, it is organizations that deploy the Baldrige criteria and the framework to improve their organizations. It is applied across every section of that organization. And their goal is to align and integrate those disparate departments and processes. ISO can be, I think its emphasis is less on organization-wide integration and alignment. Again, it's a continuum. Both are complementary to each other, but I think of ISO being a little bit more micro in its focus, Baldrige being a little bit more global. I think that could raise some interesting discussion, however. All right, seeing no other questions, I'm going to move on and talk to you about, once again, a little trouble with advancing my slides. Give me one moment. There we go. All right. Sorry for my technical difficulties. So I'm going to talk now about the state-based program, our Virginia SPQA. As I mentioned, the Baldrige Program is national in its scope. The Baldrige Program that's housed in the NIST takes the Baldrige Criteria pretty much as a whole, and organizations can use the whole set of criteria. What I'm about to tell you about in the case of the Virginia State Program is we're able to have a little more flexibility and do a little more customization for organizations, and I want to tell you about how we do that. The Virginia SPQA, it was formed in 1983, and notice that that's several years before the national program was established. So Virginia was really ahead of the game. Virginia is the first state-based quality improvement performance excellence program, the first of its kind to set up criteria based on best practices for manufacturing business. It later expanded to other sectors beyond manufacturing and also later incorporated the District of Columbia. Its mission to promote continual improvement strategies, to provide training, mentoring, and recognition to organizations that are pursuing performance excellence. It just happens that the SPQA has made the choice to adopt the Baldrige Criteria and use it in our own work. But we are not a Baldrige program, and what I mean by that is it is not in our bylaws, in the charter of our organization, that we must use Baldrige. The bylaws of our organization are only that we will promote improvement, provide training, mentoring, recognition to organizations in Virginia and DC that are trying to improve. So we have chosen Baldrige because we think it's the best, and we've continued to choose it year after year as our foundation for the work we do. I should mention, too, that we are part of something called the Alliance, which is 36 state-based programs like ours that loosely band together to support the Baldrige Program. We agree on some ground rules for how we're going to disseminate the Baldrige Criteria within the work we do. But other than that, we operate independently. And I say 36, you might ask, why aren't there 50? Many states combine and have one program that may serve 2, 3, 4 states. The SPQA in Virginia, we offer training, and we offer a program called Discovery and a program called Recognition, and I'll talk about each of these. Well, I'll stay on this slide. Our training programs, we do several times a year, we do public workshops, which tend to be 2 days long, a deep dive into the Baldrige Framework. We go deeply into each of those categories that I talked about today. Our next public training workshop will be in October or November, and very likely in Central Virginia in the Lynchburg area. Okay? We also do one in Richmond in January, and we always do one in the DC area in May. So we travel around, and a lot of it's based on demand. If you wanted us to come to your neck of the woods, if we can get a sufficient number of people, we'll come and we'll do it to our 1 or 2 day training depending on the need. So training. We have public workshops. We also do a lot by invitation. We go to organizations and we do it in-house for that organization. And we do a lot of customized training that way, all over the state and DC. We have our Discovery program, and that is our introduction. So organizations that may not be ready to look at all of the Baldrige Criteria, which is a lot. It takes a lot of time, a lot of readiness to look at all sections of the criteria in depth. This is an introduction. It's an abbreviated version of the criteria. And organizations here are given a lot of hand-holding. They're assigned a mentor who walks them through the process of filling out that abbreviated we call it an application, but addressing the abbreviated version of the criteria. They get feedback on how to improve that's appropriate for their level of readiness. This can be really good for smaller organizations or just organizations that are newer to adopting Baldrige. And then there's our recognition program, which uses the full set of criteria. It is a much more formal program. Application for participating, for an organization participating happens in late fall, early winter of every year, and it uses the full criteria. It involves a site visit, and it's just more formal and more competitive in that way. We're always looking for volunteers, for people to get involved. By being an SPQA volunteer, you learn more about the Baldrige criteria, you learn about how to apply it to your own organizations, you network with others who are like-minded. To get involved, first step, my recommendation is you get on our mailing list, and so that you are aware of trainings and our call for examiners that we make every year, that you know about that. You can attend one of our workshops that I just mentioned that we offer throughout Virginia and DC. You can apply to be a program examiner for that recognition program, and you will receive intensive training if you are selected for that. The call for examiners should happen in November. There's also, if you go to the NIST website for Baldrige Program, there is an abundance of information that is free and available to the public about Baldrige, about getting started with Baldrige. One of the things we recommend is this Baldrige Excellence Builder, which is that abbreviated version of the criteria. Okay, before I give my contact information, I'm just going to check and see if there are any additional questions about the SPQA, about Baldrige, about getting involved.
So if anyone has any questions, you can go ahead and type it into the chat box. We can even open up microphones if that's necessary.
Thank you. And while we're waiting to see if there are questions, I have put up my contact information. I welcome phone calls and emails with questions. That's what I'm here to do, is to get people involved and to talk to people about Baldrige and about SPQA.
As we wait for questions, if anybody is on the attendee list, if your name is not on the attendee list, if you could type that into the chat window, we'll make sure and get you on the attendance list.
While we're pausing for questions, I want to mention that our training programs, you can earn your RUs. I always want to call them CEUs, but the RUs for ASQ certifications. It's a good way to get a good chunk of RUs.
Find more than 0.1.
As I said, look for us in November in Lynchburg. We'll have a 2-day Baldrige training there. If you're thinking about becoming an examiner, that is an excellent place to start. All of our examiners have to have had that training.
We've unmuted the phone lines. If anybody has any questions, you can freely speak now. All right, well, it looks like we don't have any more questions, so I think that concludes our presentation today. I want to thank Rebecca Anderson for providing the presentation, and we have recorded this webinar and should be made available onto our YouTube channel. So that being said, thanks for everybody for showing up.